I am so happy that I know Dr. Lisa Radosta. She is amazing. She is one of the only 101 certified, board certified veterinary behaviorists in the world. So she is this tiny little cherry on top of a very large sundae, which is what we do with our dogs and cats and how we interact with them and how we understand them. Lisa, I already had a wonderful conversation with you on the show, just in general, about what you do, what vet behaviorists do, medications, behavior, that stuff. And in the course of that conversation, we talked about your dog, whose picture was in the background, I think. And just off the cuff, I did what I do with everybody because I'm nosy and bossy and opinionated. Oh, did you spay or neuter your dog? And so we're going to spend some time today talking about what the consequences are of spay and neutering your dog if you have that option. If you've gotten a puppy from a responsible breeder and you've reached whatever the supposed benchmark in the United States is for spay neuter, which is 6 months, and should you pause and reconsider the doing what is unfortunately, in my opinion, based on I see since 1999, serious research has been done in the physical and behavioral negative implications of spay neuter. And yet, our country is probably has the highest spay neuter rate in the world. We also have a lot of stray dogs and a lot of dogs returned to shelters. So the correlation is not there. Lisa, talk a little bit about what you decided to do and why you decided to do it and the pressures on you to have your dog have a good social life.
Yeah, I don't feel any pressure from external sources for my dog to have a good social life. Internally, I always have pressure for my pets to have a good quality of life. So I decided to neuter my dog so that he could go to daycare. I found a day, I'm not a daycare advocate or a daycare naysayer. I'm just very careful. And I chose a daycare that I really loved. And I knew he needed that. And I knew that I was not going to give him that kind of energy release. And so I neutered him so he could go. He was about 2.5. And I felt, what am I waiting for? Like, why do I care now? All the long bones are done growing. He is mature as far as cognitively, et cetera, et cetera. So that was kind of the pressure I put on myself. But as we know, as we think we know, I think it's generally accepted, and also studies have shown us that dogs are quieter and calmer after neutering. And so he didn't need daycare once I neutered him because he didn't have any energy, which was fine with me because I have lots of energy. So I need some calm energy. I like my dogs to be super calm. But so that was the dichotomy. But here's the thing about neutering, as it speaks to behavior, it is individual based on lifestyle, breed, pet parent lifestyle. So
Yeah.
not just the
Yeah.
dog's lifestyle, but the pet parent's lifestyle, predisposing factors, any disorders, behavioral disorders the animal currently has. So this is not a one size fits all. There is not, based on the research and based on my clinical experience, there is not an answer for everyone. It really needs to be individual. So I'm hoping in this short time we have, and we
Yeah.
could really do a series, honestly. I should do a series on social on this because we could talk for hours. The take home, the soundbite is it's individual to your pet. Your veterinarian should be open to talking to you about this. What is right for your pet? Just like it's widely accepted that we need to be open about what vaccines are right for which pets.
Yes.
And you need to have, as a pet parent, open eyes. If your dog is showing anxiety, that's a different answer about spaying and neutering than the easygoing golden retriever who couldn't care about anything, right? Those dogs are going to have two different reactions to spaying and neutering.
Yeah. It's a very good point. It is individual. And there isn't one size fits all, except for that there is overwhelming evidence from medical doctors. You're a medical and a psychological doctor. So you're like an MD shrink for humans.
I'm
How
a DVM. I'm a
Well, I
DVM.
know, but you're a doctor of veterinary medicine, but you are
Yes,
the equivalent of an
a shrink.
MD human shrink versus a
Yeah.
PhD human shrink. So human shrinks that are MDs now do a lot of psychopharmacology. They give medications for emotional issues, whereas a PhD doctor for humans can't. Doctors can confer with someone like you because there's so few of you, or maybe have some knowledge or opinion of their own or taken continuing education and they can use some of the drugs that are out there. But where spay and neuter is concerned, there we have blinders on in the United States, despite this very strong medical fact that if you spay neuter at 6 months, this almost arbitrary number that was pulled out of the ether not that long ago, in yours and my lifetime being longer than yours, but still, when I was a kid, we had an intact dog. Everyone had intact dogs. And that was just in suburban Connecticut and then in New York City and then in, never mind Europe. Having gone back and forth to Europe from the United States from my childhood, from age 5 until when I had a house in Tuscany, and would take a golden retriever and a cocker spaniel, if you can believe it, from California to Tuscany 3 times a year because, your dogs have to be with you. But I can tell you that nobody had spayed and neutered males. They didn't have neutered males, and the females, there were fewer females around. And the numbers actually in Italy have come up a little, but only 12% of males are neutered. And they don't have dog fights, and they don't have free roaming dogs impregnating. Only something like 25% of females are spayed because there aren't free roaming animals who aren't under someone's control. That's one of the parameters of not having spayed and neutered dogs. But what we found is just the other day on this show, I had Mark Mamula, who is a human doctor at Yale Medical School, studying a cancer vaccine for dogs that works. Amazing. And he knows, as you and I know, that you mentioned golden retrievers, which is his breed of choice, which to me is just scary. Having had a female golden, I wouldn't have a large male golden for fear of cancer. It's such a high incidence. But his younger dog, who's 3, is not neutered because of what he learned doing these trials. The behavior part is something that is one of the overwhelming reasons given for, oh, I have to, if I don't neuter this dog, mostly male people think this, he'll be aggressive. Let's talk about that because there's very little to support that. If you look at dog shows, I think that's one of the best places to look at intact dogs. You can't be in a dog show unless you have your ovaries, your uterus, and or your testicles. You have to be an intact dog who could theoretically breed if you chose to do that, which responsible breeders do infrequently and very carefully. Enormous dogs. Anyone who goes to a dog show, especially a bench dog show where you can visit and pat the dogs and talk to the breeders and owners, you don't see even the beginning of a bristly hair or shown teeth or growling.
Can
Okay,
I drop a truth bomb
yes,
here?
please
Let me
do it.
drop a
Do it.
truth bomb, which
Please
has
do.
nothing to
I
do
want
with
to hear
spaying and
this.
neuters. There are
Yeah.
absolutely breeders who are going to dog shows with spayed dogs. There are absolute,
Wow.
there's no way a judge can tell if that dog is spayed. Number two, there's
Point.
absolutely breeders going to shows with dogs who are neutered that have nudicles in. And number three,
Wow.
oh, because I experienced it. And number three, there's tons of aggression and fear and anxiety at breed shows, and people don't see it. And it's like watching a red carpet at the Oscars. It's wow in your face if you know what to look for, right? So, you know, when you see a movie star and you go, she's had, and I am a supporter of plastic surgery. So this is not judgmental, but you can
Right.
say, I can see she's had plastic surgery. She looks different than she did 5 years ago. When I look at those dogs at breed shows, I go fear, phobia,
Cut
aggression.
it out. These are your truth bombs.
People think that if
Wow.
they go to a breeder, that breeder cares about temperament. Some do, and some
Yeah.
don't. They care about maybe other things that might be important to them, but not necessarily temperament. And temperament can be sex linked. It can, in other words, females versus males. It can
Yeah.
be color linked. Okay, so when you know about Baileyev's foxes, when you breed something for to look a certain way, so this is a researcher from a billion years
Okay.
ago, was
Okay.
it Russia, Belarus? I don't remember. It
Okay.
basically took wild type foxes and said,
Oh, yes,
Yes,
I do
we're
remember.
going to breed only for temperament. We're just going to breed nice to nice,
Yeah.
social to social.
Yeah,
In X number of generations, I can't recall, these dogs, these foxes were quite social, much like dogs, and
yeah,
they looked entirely different. They didn't even look like the wild type. When you breed for a certain color or facial, like brachycephalic versus
right.
long nose, you are going to potentially change the way the dog behaves. And so when I go to, because I do adopt primarily from breeders, I adopt middle, like young adult dogs usually, because I love puppies, but I don't want to live with a puppy and because it's too much work. And
There.
so when I go, I ask questions that allow me to suss out who they really are and whether they're concerned about temperament. Because I have to help I have lived with and have to help people every day with aggressive and anxious dogs. And I see every day they went to good breeders and didn't know what questions to ask. Let's just let that go. Just because it's a good breeder doesn't mean they necessarily care about temperament. You have to vet everyone you deal with.
That's extremely good advice. And I've told the story before about the puppy Rottweiler I got, drove down to Palm Springs when I lived in LA. And I said, the only thing I care about is temperament. Friends had the sweetest, kindest Rottweiler. I lived alone on a remote hilltop in Bel Air, and having a dog who looked like a guard dog was important to me, but I didn't want him to behave like one. And he was 8 weeks old. And at 9 weeks old, when I picked him up, he growled at me. And I thought, yeah, no, I called up and I said, I think something's wrong. And he was leaking a little bit of pee. I said, I think something's wrong. Maybe he's in pain. But he growled at me. She said, oh, he's a Rottweiler. I said, I'm sorry. Remember the part where I said I only want a sweet, kind Carl, the dog in the children's book? And she said, but he's a Rottweiler. I said, but you're going to take him back, right? She said, okay, if you want. And she did.
Yeah.
So, yes, I do understand about that. So you can find yourself having thought you asked all the questions and then maybe the answer wasn't what you wanted. But I'm talking about whether intact dogs are necessarily aggressive. This is what people believe. Oh, that's like a stud dog, an intact dog, like a horse stallion. They only geld horses in the race world that they cannot really handle intact. But those
Right.
are different beasts entirely from pet dogs.
Thoroughbreds. Oh my gosh.
Yeah, I
Yes,
know.
all tech
Yeah.
thoroughbreds. Okay, so listen, here's the thing. Research. We've talked about research. This is what people need to know about behavior research. Couple things.
Okay.
Behavior research as it applies to spaying and neutering. Number
Yes.
one, the highest level of research is called a double-blinded placebo-controlled study. So
Yes.
as that would relate to spaying and neutering animals, that kind of study would look like the doctor or the evaluator, the researcher, and
Right.
the pet parent do not know whether the dog is spayed or neutered. That can't happen because you can see the testicles. Now you can put medicals in, and you can see if a female dog goes into heat between 6 and 12 months because they're going to cycle, right? So that can't happen. So the highest level of research cannot happen. Number two, prospective studies. That's a high level of research. That means you take two groups, you split them up, you monitor them going forward. The problem with that and why that will not happen in this venue, as far as I can see it in the future, is that you have to follow these dogs out for their lifetime and their environment has to be the same. So they have to basically
Right.
be laboratory dogs.
Yes.
All right, because the behavior is the sum of all things. My behavior here is the sum of my dysfunctional childhood, what I came out of that with, my energy level, what I ate today. It's
Yes.
everything.
Yes.
Okay. So the behavior is a sum of all things. So you have to keep the environment the same. So that's never going to happen. Number two, almost all of our studies from 1970s to 2025 in behavior as it relates to spay and neutering are questionnaire studies. They are retrospective studies. There's one that is not, it's prospective in German Shepherds, and that's because they were police dogs and they had the same environment. So we'll set that
Right.
every year. Almost every single one is a retrospective study. So let me ask you, Tracy, 6 months ago, on this day, 6 months ago, right on the 8th of that month, whatever that month was, what pajamas did you wear to bed?
It's literally has to be that specific.
Because they're saying, when did your dog's anxiety start? Did
Right.
it start a week after neutering, 6 weeks? Who's going to know that? So whenever you have a questionnaire, you have what's called recall bias. That
Yeah.
means what you know now kind of peppers that memory.
Sure.
Okay, so there's that. That's number two problem with what we have. Number three is that everybody's measuring different things. If you look at what was measured, like let's say 1970s to 1990s, what you'll see is that they were measuring aggression and they were lumping all the aggression together. Is a dog aggressive or not? What the heck is that? Who knows?
Right,
Then you
right.
get to the 2000s, 1990, late 1990s, 2000s. Now we're measuring fear of storms, separation anxiety. We're separating it out, right? And so the research is convoluted. The sound bite, the take home message is that based on the evidence we have, which is not like
Scientific.
in the vault, closed, perfect, it suggests that number one, animals who are already affected, especially female dogs, will get worse
Mhm.
after spaying, especially prior to 12 months. It suggests that there is very little effect on existing aggression when you neuter male dogs. So don't neuter in the hopes your dog's
Right,
going to be less aggressive.
right.
They might, but it's a crapshoot, right? And the research also points toward early spaying and neutering, like I'm talking 8, 9, 10 weeks, 6 months,
Pediatric, infant.
pediatric infant, and the 6 month mark, that these are high risk times emotionally for spaying and neutering. It's always going to come back to your individual pet, right? I live in a neighborhood where ain't nobody letting their dog run loose. First of all, I'm the dog run loose police, and I'm calling the HOA the first time I see your dog out. I will grab your dog and bring it home in case it was accidental. If it wasn't accidental, I'm calling the HOA. So there's that. But in my old neighborhood, dogs were loose all the time. So my
Really?
oh, all the time.
Where do
Because
you live?
I lived in West Palm Beach West. So I had a horse on my property. Everybody had acreage. And it was just
Got
common.
it.
People were coming onto your property to get their horse. They're leaving the gate open. Your dog's running loose.
Got
So
it.
in that neighborhood, it might be more important to have a dog who is spayed or neutered because the people coming to take care of the horses are leaving your gate open. Depends on a lot of things. It's
Okay.
individual. Yeah.
Okay, that's a really interesting point. When I spayed Wanda, I got her from a breeder because I had a dog who had become very other dog unfriendly. Not horrible, but bad enough that when I brought home two different male wimes for her to see, would you like to live with this guy? There was no way. She wouldn't go near them. She wouldn't. When I tried to bring her closer, she almost showed her teeth at me. I'm like, okay, you don't want these grown strangers. So I get her a puppy. I'm determined to leave Wanda intact because the ACL tear thing. I've never had a dog, a large sporting dogs, which is what I like, but the golden also, and a mixed breed that I got from Southampton Shelter. All of their ACLs blew, and all of them were spayed at 6 months. So I was determined to keep her intact. And I did two heats, and I thought, that's enough. That's a good amount because I had the little panties and I live in Vermont where there's some intact dogs, but not really. But I didn't think it was right to bring around other dogs that might get freaked out by it. So I spayed her at 19 months. Now, I don't know what pajamas I wore 6 months ago, other than the fact that I don't actually wear them. But I do know that right around that part of adolescence, she turned into a dog aggressive dog, and I can no longer have her around any dogs. We
Okay.
have loose, and that could be
That fits.
coincidental.
That fits
Does
with the
fit.
research because your dog was affected.
Yes.
She wasn't like, oh, I love every dog. She was like,
And I'm going
dogs
to kill
concern
them.
me. Yes,
Yeah.
but so she was affected. She got spayed, and there's one study showing, looking at lifetime exposure to hormones and behavior problems. Could it be that the longer you're exposed, the less likely you are? So that particular study shows that the shorter the dogs who are exposed to sex hormones for the shortest amount of time are more likely to have behavior problems. So for your dog, she needed those hormones. But listen, let's just use common sense. I am postmenopausal. Okay, I'm already done with all that.
Right.
So I am immersed in this culture. Now, I think that companies realize that postmenopausal women have money to spend on their
We
wellness. So
do.
they're all
We do.
targeting us,
Oh,
right?
yeah, we are.
Yeah, so we're immersed in it. But here's the thing. We know that estrogen is not just a hormone, but that it has neurologic effects.
Yes,
We know it
ma'am.
can regulate mood. We also know that the sex hormones, progesterone, testosterone, and estradiol, are important for dogs and for women to regulate mood. We know that they're related to dopamine, that's learning, reward, motivation.
Mhm.
They are connected to serotonin, impulsivity, aggression, anxiety, cortisol, which is your general stress hormone, and oxytocin, which helps you be social. Imagine at 6 months, so what is the equivalent for me as a human being? I don't know, maybe that would be 5 or 6 years.
Yeah.
You just take those away, they're
Yeah.
just gone, right?
Yep.
You are already feeling a little anxious, and then there's an abrupt drop, depending on male or female, how quickly that drop is going to be,
Right.
right? It could be up to 6 weeks if you're a boy. You just lose all that.
Yeah.
You are not going to develop normally because you don't have the neurochemistry to develop normally.
Exactly.
This is
Exactly.
common sense to me. The question is, a client asked me yesterday, a lovely, like these people sometimes that I meet, I'm like, you're the best pet parent.
Oh, how nice.
So good. And she said, I feel like my dog went from frustrated, excited on leash to barking and lunging and being aggressive on leash after the neuter. And I said, you know what? This makes a lot of sense. Your dog was previously affected and now he's got worse. But here's what I told her. I said, I can't fault you. You waited till 2 years. And
Yeah.
with that's what we would have told you. The studies compare, let's say, 0 to 6 month, so animals being spayed or
Yep.
neutered, 0 to 6 month, 6 to 12, 12 to 18, and 18 months and 1 day to infinity. What kind of
Yeah.
grouping is that? That doesn't even
Right.
make sense, right?
Right.
So we can't tell someone, is 24 months the magical time? Is it 30 months? Like we don't know. So when we say wait till 18 or 18 months, it's because that's all the information we have.
That's a great point. And I did exactly what she did. And on Wanda's behalf, I actually bitterly regret it because she could have a nice time. She's great with the puppy we got. Because again, if you get a puppy for a dog who is dog reactive, it doesn't take very long, like a day and a half, unless you have a really nasty bitch, to go, okay, I guess it's a little puppy. I'll take care of it. And now they're inseparable. And her tolerance level is saintly for him latching onto her ear and holding on and using her as a play toy. It's the only thing that I think is important is that everyone hear from a very serious doctor, you, who has lots of experience in the clinic and in her own home, that spay and neuter at 6 months, just across the board, is to be avoided. You must avoid it. And I was horrified that my own vet clinic, just a small private vet clinic, but bought out by one of those big companies, sent around an email to everyone. Oh, as if to counteract the conversation you and I are having, for example. Oh, spay and neuter is really important because it stops some cancers. Give me a break, folks. Let's say a female dog gets mammary cancer. It's curable, it's treatable. Male dogs getting prostate cancer, very low incidence. How about lymphoma, osteosarcoma, high incidence? Those cancers are proven to be diminished if you've kept as the hormones for as long as you can keep them. It's just
Right.
a question of we shouldn't be continuing to promote the early spay neuter as if it's good for their health, which is what we've been told. And we
Right.
only have a minute or two left, but Dr. Radosta is telling you it is not necessarily good for their emotional health. Because think how much everyone hates living with teenage human girls and teenage human boys. I've only heard horrible things about it. No one ever said, God, this is a great time in life. That's their puberty, folks. They're just finishing growing. They're not going to finish for another 5, 6 years. After that, I'm not saying spay and neuter your children, obviously, but it's proof that period of time, puberty, is so important to growing, to thinking, to making good choices and decisions and not acting out on stuff and like that.
Right.
So, Lisa, it's just wonderful to know you. It's very funny and of course an irony that you spayed the dog so that he could be allowed to go to daycare, which would not have made him a better candidate for daycare. It's just a rule across the board at these places. And then he was like, I'm chill anyway now. It is funny. And by the way, at 2.5, he might have become chill because of his age. Correlation is not causation. And with a wild child, Vizsla puppy, I did say to the owner of the stud dog, wow, he does parkour. He literally bounces off furniture and the walls. And she said, yeah, that's a Vizsla. They don't get an off button till they're about 2, if they get one at all. So maybe the off button comes at 2 or 2.5. Just tough it out, folks. Have a teenage dog. It's just part of life if you can. Lisa, thank you for your wisdom and your compassion and your sense of humor. And I hope we both are able to continue to exercise our free will in keeping our dogs, when appropriate, given the individual, the choices that we think are best for them and for us. And the people who are your clients are very lucky. And the vets who reach out to Dr. Lisa Radosta, she's going to give you great advice to help your own clients make good decisions about this and many other issues to do with the mind of your dog or cat. Thank you so much, Lisa.
Thanks for a good time, Tracy, as always.
It was.